Hi, I'm here to talk to you about central nervous system injurious agents and then go over some various examples of the various diseases and complications and disorders that these can cause. And again, this is a pathophysiology lecture. So, if you watch the previous video, if you're new to this, you should, which basically was not a comprehensive, but kind of a general overview of the nervous system. And then we talked about some key clinical signs because, like I said, due to the design of the nervous system, there are typically a very common handful of signs and symptoms that present with injury to the central nervous system. It's a weird sense. And then in this video, what we're going to focus on are common injurious agents or mechanisms of injury to the CNS, and then we'll go over some specific examples of them. Obviously, not all of them, but a handful of them. So let's get into it. Now, as you can see here, this is quite the list. So basically, what these are, kind of these main bullet points here. These are again the major types of injury that can occur. Or that can create harm to the central nervous system. And like I said, you're going to notice a lot of these are also injurious agents to the peripheral nervous system as well. All right, but let's just kind of talk about this list and then go over some various examples of these. So the first one that I want to talk about would be congenital disorders. Remember, when we say congenital, basically what we're saying here is either genetic or birth defect. Okay, some kind of birth defect. Now, basically, what we're specifically referring to are neural tube defects. Now, remember that when the nervous system, begins its development, I mean, we start out as basically, this one long tube, and then we obviously grow out from here, and then our brain further develops from here, our spinal cord develops from here, and so on. But basically with these neural tube defects, what we're saying here is that basically this tube isn't developing properly, and a common example of this would be spina bifida. Spina bifida. All right, very common neural tube defect, or at least the most commonly talked about one. Now, basically, spina bifida can vary. There are varying degrees of spina bifida, some more dangerous and severe than others. The worst of them is what's called a meningomyelocele. That one always twists my tongue. Sorry, a meningomyelocele. But basically, what happens there is when we say the neural tube doesn't close, what we're really referring to is an area of the spinal cord. Now, this can really happen anywhere along the length of the neural tube or spinal cord, but it typically happens, most of the time, these happen lower. But obviously, the higher up you go, the more dangerous this is, because what happens here is an area of the neural tube doesn't completely enclose. All right, so then what happens is you develop this sac. All right, and then within the sac, the meninges herniate into this sac, and also an area of the spinal cord herniates into here as well. Now, that's not just something you can surgically remove, because that means you're hacking out a chunk of the spinal cord, and you can do the math then again on how dangerous this is if this happens higher up. Physically higher up within the central nervous system. All right, so and obviously there's going to be long-term complications and effects that go with this. But that, like I said, is an example of a neural tube defect. Or as horrific or morbid as this may sound, there can be what's called anencephaly. Anencephaly literally means without a brain, without a head. So what's actually happening is you have an absence of a brain, absence of a skull, meninges, fetal tissue, and the baby actually does not develop a head and brain at all. I mean, you might see a mandible or lower jaw develop, but I mean, there's no basically there's no cranial cavity or cranial vault, and obviously that's obviously a non-survivable scenario. So those are basically neural tube defects or congenital defects. Now, there are others that can affect the brain as well. We're actually going to talk about another example of that in a little while. All right. Now, another one that I want to talk about is basically physical force. Like blunt force trauma. All right. Now, basically, with blunt force trauma, that's a physical impact on the head. All right, physical impact onto the head. Now this can obviously be quite dangerous because when you get hit in the head, I mean, various things could happen depending on how hard you got hit, what actually contacted your head, and so on. Because you could have an open injury or an open wound where the brain and meninges are fully exposed, dramatically increase your rate of infection. Or you could have a closed head injury, which again, just because you don't see an opening in the skull or the cranial bones, that doesn't mean that nothing is happening. That patient, for example, you could create what's called a subdural hematoma. All right. A subdural hematoma, basically where you slowly bleed into your where the veins that are in your kind of arachnoid matter around that area slowly bleed into the subdural space, and then as that slowly accumulates, that's going to apply pressure against the brain, and obviously if it's untreated, it could cause death. All right, or you could just develop a hematoma where you just you break open vessels and you bleed around the brain, and that puts a lot of pressure and again against the brain, and that's going to cause harm. All right, and if the injury is severe enough and you survive it, you can develop what's called the TBI, or traumatic brain injury. And this is basically an injury where, I mean, functions are lost, not just physically, but your ability to function as a person is not necessarily completely lost, but you may lose a lot of functions, various motor functions, and cognitive functions that go with this. And so I've mentioned before, I spent quite a bit of time working as a caregiver for folks with traumatic brain injuries, and it's a very difficult thing to see. I mean, I've seen TBIs as a result of slipping on the ice on a lake and hitting the head at that's a physical injury right there. I saw someone get a TBI. I didn't see the injury, but saw the patient as a result of that. All right. I've seen rare congenital problems where someone had just this rare cerebral vascular disorder to the brain, where areas of the brain were damaged due to lack of oxygen and so on. Complications of infection, high fevers, then done brain damage. So one thing you have to bear in mind is that not every traumatic brain injury is caused just by blunt force trauma or physical trauma to the head. All right. But again, physical force, and we'll go over some examples of this and talk about. I want to talk about something called coup and counter coup when I have an image to show you this. Um, Another example could be ischemic injuries to the brain, which are which are basically which we would classify this in what we call cerebral vascular complications. All right, and definitely the most common aspect of this is or injurious agent that causes ischemia to the brain is what's called a CVA, cerebral vascular accident, or in layman's terms, a stroke. All right, now if we're talking about your run-of-the-mill stroke, basically the process is very similar to having a heart attack. You develop plaque in a cerebral artery, and then either an embolus or a clot comes in here and obstructs blood flow to an area of the brain, and then all of a sudden, brain tissue starts to die. All right, very similar process to that of a heart attack, except for we're talking about a coronary artery and obstructed blood flow and tissue death of the heart. All right. Then there are other cerebral vascular complications like aneurysms that can affect the brain as well, and so on. But that happens very differently due to increased pressure on the brain, or if the aneurysm ruptures. My grandfather had that happen to him and actually survived it. Like for example, like a Berry aneurysm, like on the circle of Willis in the brain. Circle of Willis is an area where major arteries meet and form this circle on the inferior aspect of the brain, kind of right around the pituitary gland. And you develop this Berry aneurysm, and then it ruptures, and then you bleed, and that's obviously blood loss. And obviously, you're gonna have headaches and so on, and it's gonna cause death really quickly if it's not corrected, which was lucky for him because he was in the middle of the day, he was awake at work, and we were able to get him to the hospital very quickly, and it was an surgery for a long time, but survived it. Okay. But like I said, when it comes to cerebrovascular complications, ischemia is what you're going to see the most. I mean, in the United States, I mean, the number one killer of people in the United States is heart attacks, hands down. I mean, heart attacks. I mean, heart attacks kill more people than cancer here in the U.S. I think it's actually kind of sad, but unfortunately, it's the stone cold truth. And then the number three would basically be strokes. All right, so basically two very common arterial diseases or vascular diseases, vessel diseases. All right, and we'll talk about that more in a little while. Infections are injurious agents to the central nervous system and the brain, and infections can be prions, viruses, bacteria, and in some cases fungal. Okay, I'm not going to see fungal as often in the central nervous system, like you've heard me talk about before. I mean, fungal complications are much more prevalent in people who have compromised immune systems, um, like various forms of like a toxoplasmosis, usually an early sign of weakening immune system with an HIV infections and so on. But people can develop, for example, meningitis. That's a very common infection of the central nervous system. Um, Meningitis, inflammation of the meninges, the supporting connective tissues of the brain and spinal cord. So basically, what we have here is, like I said, this could be bacterial or viral. And what happens here now, meningitis is typically an infection of children, and it's very common in dorms as well, dormitories, college dormitories. And the two things those areas have, the kids in dorms have in common is close quarters, close proximity. It's easy for the infection to move around, and typically, sanitation and things like that as well. So the communicability of bacteria and viruses are obviously much higher where people are in closer contact with one another. Um, and then when people develop meningitis, you have you develop fevers, and then as those meninges swell and apply pressure to the brain and spinal cord, there'd be headaches, stiff necks, and then eventually loss of consciousness. But vomiting will typically occur before that, because remember, you've heard me talk about this before. Whenever there's ICP or increased pressure on the brain, that typically will induce vomiting. Obviously, there'll be headaches as well. All right, prions are they're friggin' weird. Basically, prions are proteins. They're not a bacteria. They're not a virus. They're not some genetically active organism. They're proteins that basically go around and just cause destruction of whatever they come in contact with. Basically, what prions do is, like I said, they're weird proteins that cause unfolding or misfolding of other proteins within cells, and that causes cell destruction. Like Creutzfeldt-Jakob's disease, or otherwise known as mad cow disease. That's a prion disease that gets into the brain, and again causes degeneration of the brain due to unfolding proteins in the neurons of the brain, which causes again a kind of a slower degeneration of brain tissue. In the area where I grew up in northwest Wisconsin, and in Minnesota, and there was something going on called CWD. Oh, geez, what was that about? 7 years ago, maybe now. 7, 8 years ago now. CWD, short for chronic wasting disease. It was a prion disease that was affecting the white-tailed deer population, and it was going. Obviously, it was a prion that was going around killing white-tailed deer, and the deer population for a couple of years went up really high because hunters were really afraid to hunt. Understandably, because they thought that because I mean, where I grew up, and I grew up in a small town in northwest Wisconsin, where I mean, a big party where hunting is more than just a sport. It's a good way to put food in the fridge or the freezer, and so you can save money on groceries. And and a lot of hunters were afraid to kill a deer and eat it because they were afraid of getting they were afraid of their own brain and spinal cord falling apart. But then it was found that this disease, that this prion wasn't, for whatever reason, wasn't able to move from deer to humans, which was obviously a good thing. And I remember they did a news piece on this on the Ojibwe Reservation right next to Hayward, Wisconsin, where I grew up. The news, like the Duluth Superior News, did a bit on this, because one of the things that one of the things that the Ojibwe Indians did when they would kill a deer, and then they would use the hide. They would tan and stretch the hide, and then use it for whatever reasons, making clothing or blankets or whatever out of it. Use it for functional purposes. And one of the things they would do to get the deer hide really soft to where they could get it to stretch, because what you do is basically you take the hide and you tie a rope to it, and you basically kind of tighten these ropes, and the hide slowly stretches out. Well, they would literally take what they do is they would take deer brain, mush it up in their hands, and then smother it all over the deer hide, because that softens it up, and softens it up just enough where you can slowly stretch it out to obviously where you want it to be. And that's something I think I've always respected of again, American Indians, Native Americans, because they're very resourceful. They don't waste any part of an animal that they kill, which is, I think, an important lesson that anybody should follow. Don't waste the resources that you have. Utilize everything you can. But again, I mean, they're literally, mushing their hands in the quote unquote reservoir of the prion or the prion, but nobody got sick from it. So then, people went out hunting again, and so on. So, but that's basically prion disease. So infections, like I said, affect the central nervous system. Chemical injuries can occur to the central nervous system via drugs and toxins. We're talking drugs, obviously, self-induced. If you tie on a couple 10 too many beers, um, various other drugs. The marijuana affects cognitive function. Cocaine, heroin, other opiate drugs, other forms of stimulants, and so on, or depressants, affect cognitive function. So drugs can and they will not only increase or decrease, stimulate or inhibit activity of the brain. Chronic use of various drugs will cause damage to the brain. For example, alcoholics, chronic alcoholics. Now, when I say alcoholic, I'm not talking about a weekend warrior where you have a beer every night, or a glass of wine every night, or a shot, or whatever, all the above, whatever you do. When I say an alcoholic, I'm talking about someone who cannot function without alcohol because they have built up a chemical dependency to it. All right. So basically, what happens here is that that alcohol gets into the brain very easily, and causes slow damage to the brain. Now, as we age, our brains are going to atrophy because neurons are going to die. Now, that neurons, they don't undergo mitosis and so on. So as neurons die, the brain is slowly going to atrophy or shrink as we get older. Obviously, we can do certain things to slow that process down, but we're not going to stop it. All right, like staying active, like reading a lot, crossword puzzles, just keeping your brain active. Not doing drugs over long periods of time. But with alcoholics, the brain atrophies at a much more rapid rate because they're constantly flooding their brain with alcohol all the time. That's killing neurons at a faster rate. So their brain is actually going to shrink faster, and that's why as you see someone who drinks more and more and more over the years, that cognitively, they become less functional and more quickly as well. All right. Then when I say toxins, I mean like bacterial toxins or whatnot. That get into the system, like I don't know, like you think of I don't know, flesh-eating disease, or bacteria that release lytic enzymes that get into your blood that can cause damage to your tissues. A rare example would be something like Terry Schiavo, with the feeding tube controversy. She was in a persistent vegetative state because she was a bulimic, and what happened was she had a massive heart attack. Well, during surgery, they were able to get her heart going again, but it wound up causing permanent brain damage because what happened when she had that heart attack, her cardiac muscle cells fell apart, and because tissue death, what happened is a lot of lytic enzymes and reactive oxygen species were leaked out of those dead cells, and what happened was as the heart got going again and it started pumping blood throughout the body, enough of those agents that those damaging agents that leaked out of the cells got circulated around the body and got into the brain, and it basically just damaged her her cerebral cortex. Okay, and put her in that state. So toxic effects of drugs. If you have kidney damage or liver damage, you're not able to, clear drugs out of your system quickly enough. Those could accumulate in the system and cause toxic effects and cause, damage to your brain and other organs. All right. So those are just examples of chemical injuries. Hydrocephalus, pressure injuries. So pressure injuries are basically, when I say pressure, I mean we're literally putting pressure against the brain. Hydrocephalus, hydro means water, cephalo, brain. We're literally saying water in the brain. All right, and this could either be a congenital problem or it could occur as a result of secondary effect of developing a tumor. All right, and I'll talk more about that in a little bit, but that's also just another example of pressure as well. All right, I mean, there's practically no room between your brain and your skull. I mean, basically the barrier between your brain and the skull would be the meninges, right? Your dura mater, your arachnoid mater, and your pia mater. And that's paper thin. Your brain, and if you look at the anatomy of the skull and the cranial vault, you know that your brain is very specifically contoured to fit right in your cranium like a glove, like a snug fitting glove would fit on your hand. All right. So as a result, if you develop a brain tumor, tissue growing out of control, you can do the math on how that's going to increase the pressure in the brain and cause, headaches, ICP, could be vomiting, loss of consciousness, and so on. All right. Again, if you're talking about physical force on the brain, if someone's developing a hematoma or hemorrhaging in the brain, all right, whether it's someone that had a hemorrhagic stroke or an aneurysm that ruptured. All right, as you're bleeding, around the brain, that's going to cause, increased pressure around the brain, and obviously cause damage to it. It's going to increase ICP, intracranial pressure. Okay, and remember, whenever you have increased intracranial pressure, you're going to see two very common complications associated with that. You're going to see a drop in consciousness, and you're going to see vomiting. Okay, so that's something to kind of keep in mind. Degeneration. Now, I really shouldn't have put demyelination in here. I just was kind of running out of space, so or I could have used my head and put these on both sides. But demyelination is kind of in a class of its own. But in a sense, it is. We could argue, but let's not. But basically, demyelination. What we're saying is the myelin sheath is falling apart. All right, the myelin sheath is falling apart. So, the most common demyelinating disease you're going to hear about is MS or multiple sclerosis. And with MS, this is, it's not well understood. I mean, a lot of people are starting to associate this as, an autoimmune disease. That this is some kind of autoimmune reaction triggered by some kind of infection that we have no idea what the infection actually is. We know there's a genetic component to this. MS is really complicated. Basically, we've got some ideas of what causes it, but realistically, let's be real, we still don't really understand a lot about what causes multiple sclerosis. I mean, aside from that there is some autoimmune aspect to it, but what really triggers it, like I said, there's still a lot more research that has to go into this. Obviously, we're moving in a good direction by understanding this more, but again, there's a lot more that has to go into this and understanding MS. But this is a disease where they believe, some kind of virus triggers an autoimmune response where you produce, again, autoantibodies, and while you're trying to attack that virus, you also attack the myelin sheaths. But like I said, that's just the best explanation they have for a disease we really, honestly, truly don't understand a lot about in terms of manifestation, or I should say, the pathophysiology of it. So now this would be more of a truer form of degenerative disease, Parkinson's disease. This is where an area of the brain called the substantia nigra in the midbrain basically falls apart. For whatever reason that is, it's unknown. We can break Parkinson's down into two categories: primary and Goodness gracious. Primary and secondary. Sorry, that's supposed to say secondary. My apologies. Gosh dang tablet. All right, so primary and secondary. Now, this is a very general way to describe a disease. If we say a disease is primary, that means just think natural causes. All right, something with some with genetics, biologically, whatever, something with your body is causing that disease. All right, so with primary Parkinson's, that's where that substantia nigra, the midbrain, just slowly degenerates over time. All right, slowly degenerates over time. Now, with secondary Parkinson's, and we'll talk more about the complications associated with Parkinson's later. Secondary Parkinson's, this is basically where where some other external force causes injury or damage to that area of the brain, the substantia nigra. So, like Muhammad Ali in his boxing career, or you get into a car accident, or you stroke out in that area, or some kind of injury that causes specific damage to that particular part of the brain. All right, that's secondary. That's a secondary disease. All right, some basically an environmental factor causing damage and causing that disease. All right, whereas primary, that's natural causes. That's your natural biology kicking in. Okay, so I'm not really going to talk much about infections and congenital problems anymore. I'm going to focus more on the other bullet points in this presentation: the physical, ischemic, chemical pressure, and degenerative aspects of injury. Okay. So, physical injury. Ouch. So again, physical injury. This is where some kind of where you have physical trauma, physical impact, to the area of your cranium. All right, I think it's pretty obvious what caused this. That's a gunshot wound to the head. Um, so obviously a bullet to the head, not a good day. Basically a bullet to the head, that is physical injury. That bullet is going to go into the brain, and it's just going to, depending on what kind of round it is, it's going to cause massive damage. If it's a hollow point and, shreds in the brain, that's going to be bad. If it's a high caliber round, it's going to cause a lot of damage. All right, lower caliber round, might be luckier, but you get the picture here. I mean, that's a clear-cut example of physical injury. Now, this is also an example of an open head wound. All right, an open injury. Now, an open injury, again, is where the skull is broken open to the point to where you see the brain and dura mater inside the cranial cavity. I mean, this doesn't have to always be a gunshot wound. I mean, someone could get into a car accident, go through the windshield, and a part of their head is open. You could get hit in the head with a bat and break your skull open. I mean, there's there's a lot of creative ways to have that happen to you. Now, obviously, the problem with that is, I mean, from a bleeding standpoint, this is actually kind of to your advantage, because by having this hole in the cranium, that's blood that's lost, and that's pressure that's not going to build up around the brain. So you don't really have to worry about increased pressure with this. What you have to worry about is infection. All right, because obviously now the brain is exposed, and you can get an infection directly in the brain with an open head wound, and you can do the math on how bad of a scenario that's going to get quick. All right. And then another example would be what's called a closed head wound. This is basically where you have physical impact on the cranium, but the skull doesn't break open. But that doesn't mean there's nothing going on inside of the cranium. All right. So basically, for example, there could be a common type of injury with physical or blunt force trauma to the head is something that's called coup, counter coup. Okay, coup, counter coup. Coup is basically what I like to think of as acceleration. All right, counter coup as deceleration. I'm going to abbreviate deceleration because I can never spell it right. Sorry. And we can also say that a coup injury is going to take place at the site of impact. I'll explain this in a second. Counter coup is going to be opposite the site of impact. Okay, so let's explain this. So here, for whatever reason, let's say this is a person who was working on a ladder. All right, you're up on a ladder. I don't know, cleaning out the gutters in the house or doing construction work, whatever it may be, and not wearing a helmet, and you fall down, and boom, head hits the ground. Okay. So basically, what's going to happen in this situation? So this person's head comes forward and it hits, so basically you hit the ground. You're going to physically, boom, hit the ground. Now, the impactive force is going to cause, basically, is going to cause the brain to accelerate, boom, hit the skull right there. Okay. It's going to cause the brain to accelerate and hit the skull. Now, the injury doesn't always stop there. The brain could decelerate. All right, the brain could decelerate and then continue to drive into the skull, or basically kind of recoil, and obviously impact another area of the skull. That's obviously bad news. So you're just maximizing the damage there. All right. Now, if let's just say we just stick with Coop injury. If we just injure a specific area of the brain, that's what we call a focal injury. What does focal sound like? Sounds like local, right? So a focal injury is an injury that's to a very specific site of the brain itself. Excuse me. All right. Whereas whereas the opposite of that would be what's called a global injury. Now there are various causes of this. It doesn't have to always be physical force around the brain. It could be ischemia due to someone having a heart attack and the brain isn't getting oxygen and the entire brain gets injured as a result of that. Okay, but this would again be an example of a focal injury. Um, so basically, like I said, you can see here with Coop counter Coop, there can be a lot of brain damage could occur as a result of this. Now, like I said, so if the skull didn't crack open here and the person got up and kind of shook their head, shrugged it off, all right, that doesn't necessarily mean they're fine. All right, that means they could have, like I said, they could have damaged some vessels and caused a slow bleed into the subdural space. That's what's called a subdural hematoma. All right, where you slowly bleed into that subarachnoid space, and then that slowly puts pressure around the brain. All right, and then eventually, all of a sudden, over a couple of days, they might start developing headaches, be really sleepy, really drowsy, might start getting nauseated, and if it's not corrected, it'll kill them. I mean, that's if I remember correctly, I believe that's how Liam Neeson, the actor Liam Neeson, I believe that's how his wife unfortunately passed away. They were skiing, and she wiped out when she was skiing, hit her head. I can't remember when she hit her head on a tree or something. I can't remember. And she got up and was all right, but then all of a sudden a few days later she was dead due to again an injury like this. So with a closed head injury, it's very important that you monitor the patient, especially, within, the first, 24 to 72 hours after the injury are very critical periods of time to monitor a patient that has a closed head injury to make sure that there isn't any, bleeding into the brain. Whether it's just your run-of-the-mill hematoma or a subdural hematoma. And if there is bleeding into the brain, for example, if someone is developing a hematoma, then obviously this is going to require basic surgical procedure where you more or less drill a hole into the skull to relieve the pressure, um, of the bleeding. All right. And again, as I talked about on the previous slide, if the injury is extensive enough, you could develop a traumatic brain injury again, which is an injury where you have typically a loss of or impairment of cognitive and physical functions. Okay. So that's physical injury. Again, vascular problems. Like I said, the most common vascular issue with the brain is a cerebrovascular accident. All right, and we can, there are two major types of strokes: ischemic strokes and what are called hemorrhagic strokes. Hemorrhagic strokes. So basically, an ischemic stroke, this is what I talked about before. You guys don't know what ischemia is, when a tissue doesn't get enough oxygen, and when a tissue is deprived of oxygen and it slowly starts to die if you leave it alone for too long. And this is the example I was talking about before when somebody just doesn't get, when I was talking about how strokes and heart attacks are really similar. All right, and artery just gets occluded with plaque. All right, then a clot or an embolus gets stuck in here, an area of the brain becomes ischemic and dies. All right, and then remember from a long time ago we talked about liquefactive necrosis. All right. So basically, as these neurons die and lytic enzymes get dumped out, and then you start undergoing the effects of inflammation, then what's going to happen is you're gonna develop this liquid tissue. All right. And then plus, since there's no connective tissue in the brain, that is really the biggest contributing factor to the liquid development here, because there's no extracellular proteins to cause kind of congealment, or like a coagulative type of necrosis. All right. So then what's going to happen is you're going to get this tissue is going to liquefy, and then you're going to undergo inflammation, and macrophages are going to come in and clean this up if you've obviously survived the stroke. And then what's going to happen is you're pretty much going to be left with a space in the brain. All right, you're going to be left with a space or an area, what they often refer to as an area of the brain when you're talking to a patient. That's basically just brain tissue that's gone. All right, because remember, you cannot regenerate neurons, in the brain. And then, so then all of a sudden, if you continue to have multiple strokes, then that area of the brain, this area of injury could get bigger and bigger and bigger and bigger. Obviously, this right here was a massive ischemic stroke. All this dark area that you see right here, I mean, that's all ischemic brain tissue, and probably a good chance this patient didn't survive. Or if they did, obviously they're going to have very severe complications with this. Now, something to keep in mind with a stroke is that you will, when you see a stroke in the brain, the effects are going to take place contralaterally. Okay, so what does that mean? Contra, opposite, lateral side. Because remember, as nerve pathways work their way up the spinal cord, at some point in time, whether it's in the spinal cord or the brainstem, they're going to cross over to the other side. All right, so if this is your right side and this is your left side, okay, so if you have a stroke in the left side of your brain, you're going to see, motor aspect, the motor effects of this are going to be on the right side of the body and vice versa. Because remember in the previous video we talked about common complications with central nervous system injuries. So if someone had a massive stroke in their left hemisphere, and all of a sudden you see, the right side of their face go, get paralyzed, all of a sudden, they lose function of their right arm and their right leg. All right, that is, basically you're seeing, hypotonic muscles, a loss of muscle tone. All right, a loss of function, and so on. They could even be atonic. There could be no muscle tension if the damage was extensive enough. All right, but again, that's a very common term you need to associate yourself with, contralateral, and like I said, the opposite sides. So if someone has a spinal cord injury before the area of crossover, the kind of the technical term, high class term for the crossing over is called desuscitation. So if there's an injury before the point of desuscitation in the spinal cord, then you're going to see the effects on the same side. Okay, on the same side. All right, and if a patient is paralyzed on half of their body due to a stroke, this is what's called hemiplegia. Not to be confused with quadriplegia or paraplegia, what we associate with spinal cord injuries. Remember, hemi means half. Okay, hemi means half. So if someone loses function, so in this situation, because because an area of the brain on this side dies, this half of the body is affected by it. All right. Whereas with a quadriplegic and paraplegic, we're transecting a spinal cord, and basically all areas below that spinal cord are affected, both limbs. If someone's a paraplegic, then then basically, they're going to lose function of both of their legs. All right, if someone is a quadriplegic with a very high up spinal cord transection or injury, then, quad 4, you lose function of all 4 limbs. All right. But again, sorry to kind of sidetrack there, but that's important information to understand. All right, but again, this is just a very common example of ischemia. Now, this would again be an example of a focal brain injury. Okay, because when you have an ischemic stroke, a specific area of the brain is going to be affected by that. Obviously, the larger the area, the worse the damage. Now, again, in the situation of someone having a myocardial infarction or a heart attack, that's going to be global ischemia because in that situation the heart isn't pumping blood to the brain. The brain is not getting perfused with blood and oxygen, and then that's going to cause basically global brain damage and brain death if it's left alone for too long. Or if a person, like, if you've gone through the basics of CPR, all right, if a patient is, unconscious for too long and their heart is out, that's the point of doing CPR. You're artificially pumping the heart and artificially pumping blood throughout the body to, supply the brain with blood to minimize brain damage, because within 2 minutes of being deprived of oxygen, you're going to start seeing brain damage. And once you start getting to about 7-8 minutes, the damage starts to become permanent. And if the damage goes beyond 10 minutes, the odds of that damage being permanent are really, really high. I mean, almost to the point to where, it's not going to be a good scenario. Okay. And this here is an example of a hemorrhagic stroke. I'm pretty sure you can figure out where the problem was here. Now, with a hemorrhagic stroke, this is different than an ischemic stroke, because this is, these typically start out as an ischemic stroke. You've got plaque buildup, a weakened vessel, plaque is building up, blood flow being cut off. But then what typically happens is that artery ruptures, and then you start seeing hemorrhaging, massive bleeding taking place. And then as that blood builds up around the brain, you see the malformation of the brain here. That's just all the pressure from the blood, pushing on the brain itself. Due to that middle artery hemorrhagic stroke. And then now the thing with hemorrhagic strokes, these are, in my opinion, a lot more dangerous than ischemic strokes, because they're going to basically they're going to kill the person a lot more quickly. All right. I'm not saying ischemic strokes aren't dangerous; they don't kill people quickly. But like I said, when a hemorrhagic stroke occurs, there's no middle ground with these. You have to treat it quickly to treat the bleeding, or else the patient's going to die relatively fast. Okay, so those are cerebrovascular complications, and like I said, ischemic strokes are, like I said, one of the most common killers of people in the United States. And there are other versions of strokes, and as I mentioned on the previous slide, people can have aneurysms and other complications as well with cerebral vessels. My goodness, reminds me of St. Patrick's Day a couple of weeks ago. Love that holiday. As a Malali, which is my last name, I value that day very much. Now, Guinness, which is my favorite beer, by the way. Sorry, looking at that's making me thirsty. Now again, chemical injuries can come as a result of, again, recreational use, whether it's through drugs like alcohol, cocaine. Now, like I said, alcohol consumption, it has to be in high amounts over long periods of time to really see major damage occur to the brain. Acute use of alcohol, where you have a couple, whether it's on an empty stomach or you have a couple 15, you see the effects of that on the brain as the alcohol builds up in the brain, and you see the neuron function become depressed. But like I said, it takes a lot of use over many years to cause significant brain damage and atrophy the brain, but it will happen. Cocaine. Again, another example of cocaine, heroin are drugs that will affect the brain. Heroin, for example, is a CNS depressant. I'm going to abbreviate depressant. All right, is a CNS depressant, and basically, when you're dealing with those opium-based drugs, like heroin and morphine, those, like you said, you feel good. They make you feel good. They give you that euphoric feeling. Euphoria is the proper term for that, the feeling good. But the big problem here is with the central nervous system depression is the depression in your breathing, all right, your respiration rate. All right, and that's something you have to pay attention to if you are actually giving somebody narcotic drugs in a clinical setting, or any other drugs like hypnotic drugs to try to, induce sleep in a patient, or sedatives, or other types of sedatives that depress the central nervous system. You have to keep that in mind. Sedatives and hypnotic drugs are a little different, by the way. But wherever you're dealing with CNS depression, like I said, the biggest thing you have to watch out for is, basically them stopping breathing. Obviously, their heart's going to go after that, and they're going to go after that. All right. like I said, very common examples of chemical injuries. Like I said, there are like bacterial toxins could cause injury or damage to the brain as well. Like I said, the Terry Schiavo example of that kind of unique form of a reperfusion injury where she pumped around all of those those reactive species and enzymes into the brain and caused very global damage to the cerebral cortex. I mean, yeah, like I said, I mean, a good handful of examples to think about that. All right, so drink responsibly. Don't do that, amongst other things, and you'll be all right. Okay. Oh, another thing I wanted to talk about. That's what something kept slipping my mind while I was talking about this. DKA, diabetic ketoacidosis. That's a metabolic condition where you're dealing with a type 1 diabetic who doesn't take their insulin. And as a result of them not taking their insulin, they burn pure fat as an energy source. All right. And now you don't want to, as much as we'd love to do that, is to just constantly burn fat. We can't do that because remember, ketones are waste products of fat metabolism. And there's a reason why we burn on average about 60% fat, 40% carbohydrates. The old biochemistry saying fats burn in a carbohydrate flame. Because at that ratio, we produce enough ketone bodies for our kidneys to excrete out of our body via urine, and for our liver to metabolize and break down. If we start burning too much fat and flooding our system with too many ketone bodies, we won't be able to clear them out quickly enough, and they'll start to accumulate in our system. All right. And like I said, you see that with diabetics who don't take their insulin, type 1 diabetics, I'm sorry, I should say to be more specific. And as those ketones build up in the system, all right, that's going to cause obviously a chemical imbalance and a pH imbalance of your body fluids, and your brain is going to be affected by that. All right. And as the brain is affected by that, basically a person who's undergoing DKA is going to look like they had a few too many of these. All right, a few too many drinks, and as a result, like I said, it may be difficult to initially treat a person or diagnose a person who has this because, like I said, they may come into the emergency room aggressive, slurring their speech, very uncoordinated, and like I said, your first response might be, "Man, they're hammered." All right, but like I said, that's why you have to. I've said in other videos, you have to do urinalysis tests on these patients because then you're going to see massive amounts of ketones in the urine, much higher. You're going to see a lot more than there should be. You're going to see glucose in the urine. You're going to see high potassium levels in the urine due to the high increased aldosterone secretion. All right, but again, that's another example of a chemical injury to the brain. And then what's going to happen, like I talked about in my previous video, you're going to start to slowly decline in your level of consciousness. You'll start to fall. Basically, I mean, it's just systematic. They get confused, disoriented, then they go into stupor, and then if left untreated, they're going to fall into a coma, and if left untreated from there, they're going to die. All right. So another common example of a chemical injury to the brain. That's something you're going to see, I mean, often enough, especially if you're working in urgent care, especially the emergency room. Like I said, I spent some time in there, and I've seen that a few times in there, and it's an interesting sight. All right, so those are chemical injuries. Pressure injuries. Hydrocephalus is an example of a pressure injury. Remember, hydro, water, cephalo, brain. Now, this picture is obviously a tad over exaggerated, but this still kind of displays what's the manifestations of this injury, especially in babies. Now, I say babies, like infants, neonates, and so on. Now, this right here, I'm not going to sit here and go over the anatomy of the ventricles with you, but these are the lateral ventricles. This would be, basically right here would be the opening to the third ventricle. And then now these ventricles should be, half the size of what they are. All right, so hydrocephalus can occur in babies and adults. Now, when it occurs in babies, it's typically a congenital issue. Okay. Now, you remember studying your ventricular system. You've got your two lateral ventricles, and you've got your foramen Monroe, your third ventricles, aqueductus sylvius. All right. Then you got your fourth ventricle, your foramen of Magendie and Luchka. CSF flows around the brain. Pardon my horrific art. I hope you have an anatomy book with a better picture of this near you. Um, but basically, I mean, we produce cerebral spinal fluid, or CSF, but via blood flow to the brain. I mean, blood circulates. There are these capillaries in all of the ventricles called choroid plexus. All right, in the lateral ventricle, lateral ventricles are on the floor. In the third ventricles are on the roof. Fourth ventricle are kind of kind of back along the wall there. All right, and we're not gonna stop blood flow to the brain. So we constantly pump out just a little bit of CSF, and it circulates in a very systematic fashion from the lateral ventricles, third ventricle, aqueductus sylvius, the fourth ventricle, and then around the brain. And then that CSF is gonna get reabsorbed into those arachnoid villi in the subarachnoid space, and then eventually back into the bloodstream. All right, and now, if we're talking about this being a congenital problem, what will happen here is that we'll have some kind of obstruction. One of the ventricles or aspect of this system won't develop properly. So then the cerebral spinal fluid won't be able to flow around the central nervous system, the brain and the spinal cord, and we won't be able to recycle it and continue to rebuild it like we normally do. So then what's going to happen is that CSF is going to build up within the ventricles, obviously where the obstruction occurs, behind the obstruction, I should say. Now that's why these you see these dilated or expanded ventricles here. All right, now you can do the math here and how this is going to increase pressure in the brain, because this is going to create an outward force, all right, against the brain, and that's going to just force the brain right up against the skull. Now, babies have an advantage though, because when they're born, remember when they're first born, they've got those fontanelles, those spaces in between the cranial bones, and the cranium will fuse. It takes a little bit of time for the cranium to come together after we're born. So basically, as these ventricles are expanding and creating literally an outward force, on the brain, their cranial bones are also going to expand as well. So you'll actually see an increase in the size of the head of the baby. Now, also, if the since this cerebral spinal fluid is going to back up and it's not going to flow properly, excessive amounts of it are going to be absorbed, through these arachnoid villi, and basically you're going to have excessive fluids building up in the veins of the head. So, a common sign of hydrocephalus, remember a sign is something measurable, something you as a practitioner can see, is going to be an enlarged cranium and then distended cranium, veins on the cranium. All right. Now, this isn't something you can just surgically go in and just, I'll go in, open up the brain, blah, 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 open this up, because obviously, it's going to cause a lot of brain damage. So typically what you have to do in this situation is you have to put in a shunt. Basically, you insert a tube into the brain or meninges, and then that's going to and then there's a hose that runs right down, basically kind of down the head and neck of the person, down to the abdomen, that's going to basically drain fluid, typically into the peritoneal cavity. There's some variations of where that gets drained into, but typically into there, and then that's going to relieve pressure around the skull. But obviously, that's going to be a permanent deal there. This can also happen if you develop a brain tumor, and this is typically how you're going to see this in adults. So someone could develop a brain tumor, and that brain tumor could press against, again, the lateral ventricles, third ventricle, aqueductus sylvius, wherever. And obviously, if we obstruct that flow of CSF, it's the same effects. Now, it's going to be a different story here, though, because as adults, our cranial bones are basically completely fused together. All right, we form these immovable joints that help support and protect the brain itself. So basically, when hydrocephalus occurs in an adult, like I said, in a situation like this with a brain tumor, that brain is going to press against the skull, and then it's not going to go anywhere, and you're going to see severe headaches and so on. All right, so like I said, babies actually have an advantage over us adults in a situation like this. But obviously, if the situation isn't corrected, it could cause severe brain damage, severe mental retardation, and so on. In these children, if it's not corrected quickly enough. Okay, so that's hydrocephalus, and then this is an image of a glioblastoma. probably one of the most, if not the most aggressive brain tumors that can develop. And you can see this is a massive tumor. All right, this is a massive tumor, and if basically you can figure out how this is going to increase pressure, in the brain itself. This is going to, again, cause bad headaches. Could cause a person to become nauseated or vomit. Um, I mean, there's a good chance this might be, I mean, if this tumor gets any bigger, it's going to start impairing vision. All right, and obviously it depends on where the tumor develops and what effects are going to be lost, because that's something about the brain, is that one of the very measurable ways to assess brain damage is what function is essentially lost. If a person loses their ability, if sight starts going south, you might think something's wrong with the occipital lobe. All right, if they become uncoordinated, you might think it's a cerebellar issue. All right, if they just kind of lose all sense of judgment or lots of judgment, you might think there's a frontal lobe problem. Somatosensory issues, parietal lobe. You get the picture here. Hearing issues, auditory issues, temporal lobe. Again, those are just very rudimentary examples, but you get the picture here. All right, so so again, I mean, brain tumors, like I said, also cause increase in pressure. And then the last thing I want to talk about are degenerative mechanisms, whether it's demyelination or just flat out degeneration. Like as I talked about at the beginning of this presentation, I talked about multiple sclerosis or MS and how this is a demyelinating disease. Now, the tough part about MS is that it can essentially manifest anywhere in the central nervous system, and it typically is a disease that affects you as you age. Usually like in your mid 30s and your 40s and up is when this disease starts to manifest. Now, you think about all that. That's what makes it a little tricky to diagnose, because if your vision starts to go bad and you're 38 years old, I mean, what are you thinking? 38 years old, my vision is supposed to start going bad, or getting more fatigued, or whatever. Not. I mean, you think it's something associated with aging, and not every physician is going to think, "Oh my God, MS," right away when a patient comes in. So multiple sclerosis could be a little tricky to diagnose because, like I said, it can essentially manifest anywhere in the central nervous system, and a lot of times it mimics the effects of aging, as well. But it'll eventually get diagnosed as the complications get worse, and you run the right test for it, and so on. But but again, when we say a demyelinating disease, it's when the myelin sheath falls apart, and then that's when conduction velocity goes south, and then the inability to send impulses out to those muscles in a quick, coordinated enough fashion causes again, the neuromuscular complications that you see with MS. Now, one thing to bear in mind about MS, though, is that people don't die of MS. They typically die of pneumonia or other infections. Like you see with a lot of infections. So that's something to kind of keep in mind. And in brown here, what you see, all this brown these are phagocytes invading the area, because remember, where there's injury, there's going to be inflammation. So where this myelin sheaths are falling apart, via injury, they're becoming injured, these phagocytes are here to clean up the mess. So this is obviously not normal. And then with Parkinson's disease, this is a disease, again, that we don't know the cause of, and that only gets worse as it progresses. Alzheimer's would be another example of a degenerative mechanism. Huntington's chorea will be another example of a degenerative aspect, the problem with the brain. But with Parkinson's, that's where the substantia nigra of the midbrain falls apart. With Alzheimer's, that's where the cerebral cortex falls apart. With I say fall apart, I mean, obviously it's more technical, and there's more technical things happening in that, but you get the picture. With Huntington's chorea, that's where typically initially the motor areas of the brain first start to kind of go or degenerate or fall apart, and then the cortex, because typically you see the motor functions go with Huntington's, and then you start to see cognitive issues as well, aggression, loss of the personality, and so on. All right, but now with Parkinson's, you typically see the motor effects. So this is a person who is getting into the more advanced stages of Parkinson's disease. So what you see here is, because remember, this is a disease where you have abnormal muscle tension, and what's going on here is that, remember, basically as the substantia nigra falls apart, your dopamine levels go down in that area, and that has something to do with keeping your muscles relaxed when you want them to stay relaxed, lowering muscle tension. But then without that, basically with the loss of that, that causes an increase in tension. Now, you can typically control that in the early stages by just moving your limbs around because the tremors develop when you're not moving. But then as this gets worse and your muscles just become more and more tonic, then that's when you see the change in posture. All right, that's another very clear cut example of a motor dysfunction or problem in a person is postural changes. You can see, notice how the feet are pointed outward, and you see the shifted gait with how the person walks. They'll have speech problems or abnormalities because you won't be. Because remember, your tongue's a skeletal muscle. You'll have a hard time controlling that. Your facial muscles. Eating, chewing, and swallowing is going to get more difficult. And it's a horrible thing to watch somebody go through any of these degenerative diseases, whether it's a demyelinating disease like MS or degenerative diseases like Alzheimer's, Huntington's, or Parkinson's. Okay. So those are kind of some common injurious agents. I'm not really going to go over this right now, the peripheral nervous system stuff. But those are common injurious agents to the central nervous system. Like I said, I'll save the peripheral nervous system stuff for later. But yeah, that's this video. And if you have any questions, feel free to ask. If not, good luck with your studies and keep your stick on the ice.